Unit 2 Fundamental Questions. 1. The nurse is preparing to give an intramuscular injection. Which one of the following sites has the least amount of blood vessel and major nerves located in the area? 1. Deltoid. 2. Dorsogluteal. 3. Vastus lateralis. 4. Triceps. Answer 3. Vastus lateralis. 2. A nurse administers an intravenous solution of 0.45% sodium chloride with respect to human blood cells. This solution is 1. Isotonic, 2. Isomeric, 3. Hypotonic, 4. Hypertonic. Answer 3. Hypotonic. 3. A client's laboratory values indicate hemoconcentration secondary to fluid loss. Which intravenous solution should the nurse anticipate will be ordered during initial fluid replacement therapy? 1. 10% dextrose and saline. 2. 5% dextrose and water with 60 milliequivalent kCl. 3. 5% dextrose and water only. 4. Distilled water. Answer 3. 5% dextrose and water only. 4. Before surgery, a client was instructed in the use of incentive spirometer. The primary purpose of this activity is 1. To encourage coughing. 2. To arouse and stimulate the client. 3. To encourage deep breathing. 4. To measure tidal volume and expiratory reserve volume. Answer 3. To encourage deep breathing. 5. A client has been vomiting for 24 hours and is experiencing dizziness and rising. During an assessment in the emergency department, the client's skin pale and moist. The blood pressure is 108/70 when the client is supine and 88/70 when the client is standing. The nurse suspects that this client has 1. Hyperkalemia, 2. Hypoglycemia, 3. Fluid overload, 4. Orthostatic hypotension. Answer 4. Orthostatic hypotension. 6. Which assessment data should the nurse anticipate when admitting a client with an extracellular fluid excess? 1. Elevated hematocrit. 2. Rapid 3D pulse. 3. Distended jugular veins. 4. Increased serum sodium. Answer 3. Distended jugular veins. 7. The nurse explains to client family that humidification is given with oxygen administration because 1. Oxygen is highly permeable in water, thereby increasing gaseous diffusion. 2. Oxygen is very drying to the mucous membrane. 3. The partial pressure of oxygen are increased by water dilution, allowing more oxygen to reach the alveoli. 4. Water acts as a carrier substances facilitating movement of oxygen across the respiratory membrane. Answer 2. Oxygen is very drying to the mucous membrane. 8. A client diagnosed with a lower GI bleed has an order for 1 unit of packed red blood cells. What information is most important to be documented during this procedure? 1. Vital signs prior to procedure. 2. Confirmation that the nurse alone verified the blood label information. 3. The total volume that is to be infused. 4. Vital signs before, during and after procedure, date and time started or completed. Answer 4. Vital signs before, during and after procedure, date and time started and completed.